your body doesn't know that it's like, oh, today is chest day. Like that's the only thing that's going to work. If your chest is still sore and you want to go to legs, like that's fine. Like it's okay to skip. Like I'm already thinking like this weekend I'm going to be busy. So I kind of want to like do legs tomorrow rather than this weekend. It's like, it's okay. Like my body's not going to be like, oh, we missed arms. We're just going to have to start all over again. And I think it's people get stuck in this routine, and it's good to be in a routine, but it doesn't have to be so stringent in the fact that it's like,
Well, first of all, thank you so much for being on the show, Ravin. Appreciate you being
of
here,
course.
man. We already got a couple workouts in together, so I
Yeah.
already know the man is as good as he is on Instagram.
Thank you.
How's your 2020 been as far as like quarantine and stuff and the whole process?
Yeah. All right. So 2020, obviously for everyone, it's been interesting.
Definitely.
Right now. So I guess 2020 started off, I was in my fourth year of medical school. So I was like looking forward to graduation, match day, all that stuff. And then, I flew home, I went to school in Florida. So I flew home to Jersey just to say what's up to my parents. And then, I never kind of flew back down ever because all the flights got canceled. So we had our graduation, everything in May virtually, but like really from like March, April, May, I didn't do anything. I just kind of like relaxed, sat around. We did our like rotations we had virtually online. And then I started residency in July. So that was just kind of like a wake up call from like going into like sleeping in every day, all this stuff to like you're working like 80, 100 hours a week during residency and like really ramping it up. So I feel like it's been, I guess it went from like strict quarantine, like what you think of like what people did during quarantine, like nothing really, to like ramped up to like my day to day is like pretty normal because I'm in the hospital. So there's no really restrictions. We're kind of in there every day. So it's kind of ramped up from like, it was normal, then went to quarantine mode. Now it's back to my normal as well as far as my work routine goes.
Yeah, man. So you're in residency now during quarantine. That's a big switch up, man, to go from
Yeah.
just chilling to like on call everything and
Yeah.
Oh man. So one thing I was curious about with you coming out of medical school and like you being in residency now, the fitness thing is like you're a big fitness guy. I'm a big fitness guy. How do you do it? How do you keep your time frame so well?
So I think you have to make it a priority. I think it's just one of the things you have to decide. Like you have certain things in your day, like you make sure to call certain people every day. You make sure like everyone checks Instagram every day. Like fitness should be one of those things that you make it a priority, and it's like one way or another, I'm going to fit it in. And I think people get caught up with, it's an hour out of my day, but it doesn't have to be. Like some days I honestly can't make it to the gym. Like I'll just come in here. I have my room. I have like my one kettlebell, my foam roller, and just get some work in like 20, 25 minutes. And I feel like people overthink it and they're like, I'm going to have to do this. I'm going to have to shower afterwards. But if you just stop thinking about it and just go for it, like, all right, whatever happens, whatever time I get off work, if it's 5, 6, 7, I'm just going to go and whatever work you put in there and just come back and do it. Cause I feel like people overthink it. And I think scheduling it ahead of time, because even right now I'm thinking 2 weeks in advance, like my rotation is going to switch. I'm like, when am I going to be able to go to the gym? What time's going to work best? And I think just to try on error, you're able to fit it in. But I think if it's a priority to you, I feel like a lot of people get worried who are like fitness enthusiasts like yourself and me. They get worried when they enter new stages of life, like, how am I going to be able to handle this? I think if you have a true passion for it, you'll be able to find out. But if you're just starting, it definitely is harder. And I think just finding something that you truly enjoy and making time for it. And, if that means sacrificing some other things, that's all right. Like, I know a lot of people are in school right now and they feel like a lot of people I went to school with thought like, you got to study like 16 hours a day, but it's like, if you study 15 and a half and work out for 30, it's kind of better for you. You don't have to worry about studying all the time. Like no one's doing that. So I think if you come to terms with the fact that this is an important part of your day that's going to help you be more productive in the long term, it's easy to stick with.
I definitely agree with that, man. I think between planning it out, making it a habit, you always have time for the things you want to do, whether it be checking
absolutely.
Instagram or going to call your friend or, eating. You have to eat, you have to sleep to some extent, So figuring out what that process is and that importance of where fitness is and putting it in wherever you can in that schedule is super important. Just to kind of backtrack on what you said before. There's certain days when I was like super busy or like I trained a lot of people and I couldn't do things that I wanted to do because even during quarantine I was like driving for Uber and stuff in between training people and all that other stuff. So like there was days where like my own fitness took like a back seat. But when I got home, I was like, all right, I'll just do 20 minutes today, because I think the importance of just keeping the habit up of just like, okay, mentally having that space in your head, like fitness is important to me. And even if it's only 15 or 10 minutes today, I'll keep that little like set in stone thing, because I know next week I'll go back and do a full hour in or full 45 minutes or whatever it is. Like, I think I agree with you in that, like, you'll find time for it, even if it's a little bit of time. That one little, like, this is it. This is all I got for right now. Doing it and sticking to it will get done.
Yeah, and I feel like if you just limit your distractions, you know, a lot of the times there's so much like, you know, going to the gym for me is like a process. Like, I got to get the pre-workout, I got to get the clothes to match, like shoes and all this stuff.
Oh
But
yeah.
I think the less decisions you have to make from you, you know, finishing work or waking up to getting to the gym, that really helps a lot of times. Like when I'm at work, like I'll already pick out clothes the night before. Like I have the pre-workout mixed already. So it's literally like I get out, change in my car, and just go in and everything's decided for me, you know, because I feel like if you go home and it's like, oh, like, let me just take a nap real quick, then I'll go, like, that's not going to work. Like, you go straight from one thing to the next. Like, if it's from the gym, you go, you know, you wake up, go to the gym, then straight to work. You know, I think people do this back and forth a lot of the times, and they're like, oh, you know, I'll get to it, but just make it a priority right now. It's like, no, like, this has to get done, and then I can do whatever else I need to do, you know?
Absolutely. Absolutely. So what if, like, how your gyms, well, you were in Jersey for a while. You're not in Jersey right
Yeah,
now, are you? Or you're in Jersey?
I am. And
Or you are in
like
Jersey?
Vineland, like
Okay.
South Jersey.
So, so while the gyms were closed, what were you doing to keep yourself, you know, fit? I saw you had the Zoom
Yeah.
workouts going on. What was your like process of creating your workouts during the quarantine?
Yeah. So initially I was like, oh, this is perfect. My body felt amazing for the first time in years, like no soreness, like my joints were feeling good. So I was just doing like workouts in my basement. I have a good amount of weights in there, nothing too crazy, but I was just doing that. And then just randomly the Zoom workout thing happened. Some of my cousins were asking me to, you know, like host a workout for them. And I was like, well, why don't I just do this on a larger scale for more people? And it really just like blossomed, you know, like my biggest class at one point was like 60 people on there. So
Wow.
I think when I was getting into it, I was so focused on the Zoom classes that my own fitness was taking a toll because I was doing 2 classes a day, 6 days a week. So I was like, oh, you know, I'm getting my workout in here. But then I was just kind of like, you know, I don't feel as strong as I am. So I cut back the Zoom class and I was only doing one a day. And then kind of sticking to my schedule. My usual split is like I'll do chest, I'll do legs, shoulders and back and arms all on a separate day with abs and cardio every day. And it was just hard to keep the motivation, of course, but it was more, I guess, discipline that carried me throughout. Because it, you know, it's not as good. You know, you miss lifting all the weights. Like you're not as muscular as you look. So it was a lot of cardio and hit, which is like I'm good. I did enough hit for the rest of my life. Like if I don't do any more hit, I'm good.
I
That's
feel
all
you
I
on
was
that.
doing. Like so, you know, I'm so happy the gyms have opened. Ours is pretty late compared to a lot of people because I was talking to some of my friends in Florida, Texas. They were open already in May. Like
Yeah,
you
they're
know,
open for a
so
while.
we waited until September.
Here in
So I've only been
California,
in
it
the
was
gym
the
for
same.
like for like 3 weeks. So like I'm just now like getting my strength back. Like when I first went the first day, it was very humbling. Just like even 135, you're just like, oh, I can't do it, man. Like getting so tired so quick.
Yeah, man, that first day back is brutal. But California was also one of the places that took a while to get things open. Like we opened fast and we closed them again, and like now we're at like
Yeah,
10%. So it's still like definitely a whole thing. One thing that you did
yeah,
say that I liked was that you were saying you were doing 2 classes and you cut back down to one because you weren't getting the adequate training that you wanted to out of it.
yeah,
And I think that's a big thing, man. Like one of the biggest things that people kind of misconstrued is that, you know, fitness is, there's definitely some optimal things to get the most out of certain results, whether you're trying to go for performance or strength or size, you know, whatever you're training for, it's definitely like a key set of rules that you want to hit fitness
yeah,
wise. But it also is your life. So like, even though like if you could train whatever squats 3 times a week, that might be ideal for your goal. But if you're just working out to keep yourself in shape, you know, you can do 2 times. You can change it to how you want to, you know. I think
yeah,
that I try to teach people that like fitness is kind of like, it's kind of like fashion in the sense that, you know, certain things go together, like certain things match, certain things correlate very well. But you still have a lot of freedom of what you do as long as it's keeping you consistent in what you're doing.
yeah, absolutely. And I try to tell people, it's like people would be like, yeah, I can definitely not hit arms because I just hit them like 2 days ago. It's like your body doesn't know that it's like, oh, today is chest day. Like that's the only thing that's gonna work. Like if your chest is still sore and you want to go to legs, like that's fine. Like it's okay to skip. Like I'm already thinking like this weekend I'm gonna be busy, so I kind of want to like do legs tomorrow rather than this weekend. It's like it's okay. Like my body's not gonna be like, oh, we missed arms. You know, we're just gonna have to start all over again. You know. And I think it's people get stuck in this routine, and it's good to be in a routine, but it doesn't have to be so stringent in the fact that it's like, no, I can only be hitting the weights. But it's like, you know, for a while, if I'm just like, you know, I'm just gonna go for high volume, like, you know, lower my weights for a little bit. It's good for your body. You know, it's like you don't have to be doing the same things. Like I do a lot of the same because I like it, and it's been working for me. and I genuinely enjoy it. But, there's times I get frustrated and I'll try to switch on my routine and then go back and be like, this is working for me, this isn't working for me. So I think it's very dynamic. And the sooner you realize that and are able to make the changes, it makes it more fun for yourself and change up your training.
It does. It really
Yeah.
does. There's I think one thing that it's definitely really cool is how the transition of what, why do people go from like people that are working out in the gym like ourselves, people that like to working out at home, to like changing that up, because I didn't have that much equipment, because I was like, oh, I work in the gym, I don't need any equipment, like I'll be
Yeah, of
okay.
course, of
And
course.
then I learned my lesson real quick. Quarantine taught me a lot about making sure I'm
Yeah.
prepared for stuff at home too. But like the just that initial switch up of like going from doing more stuff in the gym or doing more stuff at home, how did you find like the motivation throughout to
Yeah.
get up from watching something from Netflix to go work out? Like, what was that like? How'd you get that gear switch of like
Yeah.
workout time to home time?
So it was definitely a transition point, because my diet definitely suffered, because I was like, because right now my diet in general, my diet's pretty strict. Like I'm always thinking like it's bad, but I'm the person like, oh, like if I eat that donut today, like I can't eat this later, and I'm like, no, I can just hold off for 2 more days and I'll eat this because I know we're going out to dinner this day. But then like during COVID, I was like for a month straight, I was just kind of like, you know what, like screw it, like let's snack on some chips, like with like because I was living at home with my parents, it's like hard to be like, oh, mom, can we just have like ground turkey? Don't put any spices in it, and like don't make any rice or anything. That's all I eat. It's hard. So I kind of let myself enjoy, and it was hard to be like, what's the point? Like my diet's not on point. It's like, why am I training and all this stuff? But then I think once I made it a routine, like it was just like right when I woke up in the morning, like, I slept in for sure. As soon as I woke up, the first thing I did is go downstairs, work out, get the workout in. And then it was, I guess making it a routine was easier. You obviously don't feel motivated during these times, but I think the discipline carries you farther. Like I always say that. It's like, even the people on Instagram who look like they're working out every day, like you don't always feel like amazing. Like you don't feel like you want to go work out. Like your body is broken. Like you're just tired of this. Like, it's gonna be a drive and a whole process. Like, but I think the discipline of like, you just have to get it done. It's like a lot of people don't want to go to work, but you still do. You never just like, I'm just gonna skip for like 2 or 3 days,
Fuck it.
So
Don't worry
it's
about the
like,
bills.
why would you skip the gym, And I think it's one of those things where it's like discipline is going to carry you way farther, and with gyms opening up, I feel like a lot of people did start workout regimens that they're going to transition into the gym, because a lot of people said they didn't have time before, but COVID really showed them like their ability to work from home, being like, I do feel better when I'm working out, because a lot of people for this, their working out ability went up. Like people are buying Peloton, people are getting whatever class they're getting, and they're like, wow, I feel better, I'm losing weight actually.
Yeah, yeah, I agree. I agree. And so you being a new resident this time like
Mhm.
at a hospital, I mean, I'm sure like you don't know how it was before like all this happened, but how is that now? Just like the mindset, like the are people that are around you telling you that things are more strict now? Like, what is the difference you think
Mhm.
between how does it feel for you personally being in that scenario, and
Yeah.
how does it compare to the people that are around you? Like, this is different because of this. Like, how does that feel being a new resident during this time?
Yeah. So I was in the hospitals in February when COVID, I guess in the beginning of February when COVID really started to gain attention. And I like distinctly remember all these doctors being like, COVID's just it's not a thing. Or like some were like, yeah, it's going to like mess everything up for real. And then, I kind of went on vacation for 2 weeks because my rotation had ended. And then that's when, COVID really hit in March. So there's so many different changes. Like we were all very nervous to go into the hospital because we were like not used to wearing all this PPE, all these masks. Because in the hospital, you can just go in scrubs, no mask, you have your stethoscope, and that's about it. That's all I usually wear. But now it's like, you're very cognizant of wearing a mask. And then like, I'm thinking like, is this a COVID rule out? Like, should I switch to an N95 mask? Do I need eye protection? Should I wear a gown in this room? What's my clinical suspicion on, this patient? There's a lot more steps now with patients, like admitting them and like kind of how long we keep them. It's like, well, we can't move them to this facility because they want them to be COVID negative first. And now we got to wait for that test. There's, in terms of a logistics standpoint, it's way more. And just in terms of like simple things like going to the cafeteria or hanging out in the call room, there's certain restrictions, and
Yeah.
like even our didactics, like our class-based stuff that we do as residents, like, we can only have 10 people in the classroom, whereas opposed we used to fit like 30 people in our program in there, but now it's only 10. So it's a lot of online meetings and that. And like, we're not immune to that whole social distancing in the workplace. Like we'll only have like 5 or so people in certain areas and certain rooms are like, all right, you know, like only the attending will go in, or only the senior resident will go into this room. But I think I caught it at the tail end where it's more normalized, but it was definitely worse from what I heard from the other residents. Like the hours you were working were crazy because they were just trying to do like 24-hour shifts. Like they were limiting the exposure of how much you're going in and out.
Wow, 24-hour shifts?
Yeah, I just worked one on Friday, so I got my first experience of it. It's just like, it's like one of those things you just do it. It sounds like impossible, but you just do it.
I give you guys props for it, man. Like that medical
Yeah.
stuff that's a tough field to be in, man. Much
But it's
respect to
cool.
you for being there.
Yeah, thank you.
But I just yeah, man, like I just can't imagine how different things are going to be as far as like the changing of systemization of, you know, how many people are going to be inside hospitals and how many people are going to be like just the ruling of stuff. Like you were saying, they have to check like being a negative before you even put them in a different area.
Yeah. Right.
And that just seems like horrifying. Like it makes sense, but just like holy shit, that's such another level of things to have to worry about.
Exactly. That's the thing. It just adds another layer of complexity to an already complex field. And this is just one example. You know, there's so many different industries that are being affected that we don't even realize, you know, because you're just not in that industry or you don't purchase anything from that industry. But I don't know. It's hard to, you know, everyone can speculate on, you know, how the next few months and years will go, but it's gonna be interesting seeing it. Like I honestly didn't think we'd be where we were now in September. Like in March, I was like, oh, this is gonna be closed down for the rest of the year. Like I thought we were just gonna be done, you know, like, but it's interesting how it's opening up. And I guess like we only really know X amount of information, and we'll look back on this in like 5 to 10 years and be like, oh, we should have done this or that. But it's hard because, you know, we're working with limited information, and, you know, I feel like everyone's just trying to make the best decision, I guess, economically, how socially acceptable it is and all this stuff. So just kind of like we're erring on the side of caution, and like, I feel like it's almost better. It's like, you know, later on find out, oh, you know, it wasn't really that necessary. It's better than like, oh, wow, we should have done more. I don't know. You know, there's so much information out there. You know, it's hard to like pick your resources and, you know, stay informed about a lot of this stuff.
It definitely is. It definitely is. And one thing that I think, because no matter what, like things happen, it is what it is. You can't really control all this. But what you can control, you can focus on. I think one of the biggest like benefits of all this happening is that, you know, people have seen what like they can handle more than what they thought they could handle, you know. I'm sure there were things that you're doing right now that you would have thought in 2019, like, oh, like, I don't know if that's even, like, you wouldn't even have thought, oh, I can handle this. I can do 24-hour shit. You know what I mean? There's just certain things that you wouldn't even have thought. So I think on that note as a whole, like, I feel like everyone and people overall are benefiting because they're getting another level of resilience that like they may not have had if it didn't happen.
Yeah, and another thing I think that, you know, especially the March, April time, especially if you're in the Northeast, like it really slowed people down, you know, but like I had this conversation with a lot of people that, you know, we were going so fast as a society that we didn't care about anything, you know, as long as it doesn't affect your day to day, like we didn't care about anything, you know. It's just like, we were going 100 miles an hour, and this is like the one event that really just kind of like put the brakes on everyone in every industry, you know, like no, even like athletics, you know, when it expands to athletics, so there's so many like social and like political and medical events that have happened over the years, but like no matter what epidemic or whatever it is, like sports never stops. And really like when like the NCAA canceled a tournament, then you're just like, you know, that affects so many people. That's just one example, but so many industries had to slow down. And I feel like it really gave time people to realize like, you know, do I even like what I'm doing? Like, you know, I feel like it gave some people some time to reflect. It's like, you know, like, wow, I haven't hung out with my kids in this long, or like, you know, I haven't hung out with my parents in this long. And like, do I really like this person I'm with? And like, you know, for good or for better or for worse, you know, I feel like he gave some people time to reflect. And it's like, you know, is my living situation all right? Is this? And, you know, it's interesting from that aspect. You know, I don't know if it's good or bad, but people are able to reflect.
I think, I was able to reflect a lot. Like I was thinking about a lot of things that I was doing. Like one of the biggest things I wanted to do this year was kind of work back more on my podcast and get this growing up again.
Yeah.
And I was kind of just showing the day-to-day of training inside my gym and then trying to do this, social life, you know, just trying to fit things in. And then COVID really just slowed things down for me. It was like, all right, like what things did you want to accomplish this year before? What things are still possible? What can you still accomplish this year that you were trying to accomplish this year? And that was one of the big things. I was like, wow, like I finally got time to get back at the podcast and hitting people up, you know, putting stuff out. So it's definitely been a good experience, you know, with all the craziness happening on. It's definitely been a good experience as far as like me kind of like understanding me and what I'm trying to do. Have you found
Yeah.
anything, have you reflected and found anything good about yourself or new?
I think for me, like I'm very like type A, like I just try to get one assignment done to the next. That's just how I'm wired in terms of like my schooling. Like I went through school very quickly, and like, being in the medical field is like, there's certain expectations and you just fulfill them and you move on, and it doesn't stop like where, you're in pre-med, you're taking the MCAT, med student, going into residency, going to fellowship. And it's just like you're just checking boxes and trying to be like the top of each one. But COVID, I guess, really made me like stop and think like, just start enjoying some of this, because I feel like it's flown through. And I'm even like, I celebrate graduation, but I'm not like, all right, now I got to think about fellowship, because I'm trying to do like sports medicine afterwards. I'm like, now I got to focus all my attention on that. But it's like, I feel like for me, especially in those people who are driven in their careers, it's just like you're so focused on the next step and the next step that you forget, like, like 5 years ago, you were like worried about this step and you finally reached there. So I guess slowing down and just kind of reflecting and enjoying the moment and being like, let me enjoy the responsibility I have right now and the expectations that I've already like surpassed, and just enjoy where I'm at.
Yeah, I agree. Definitely. This also definitely made me pay more attention to the moment. I started meditating this year. That's one thing I really started doing a lot more, and kind of keeping myself
Mm-hmm.
present. Um, One thing that I think with you guys, you being like in your field is very, very competitive, very stressful,
Mm-hmm.
very, you just have a lot, you have a lot, and you're preparing to have a lot more. Is there anything that you do personally to keep yourself like decompressed? Is it just the gym, or is there other things you do as well?
I guess it's the gym, obviously, like that's a huge stress relief for me, but I just don't take it too seriously. I feel like a lot of people take themselves and this field very seriously. There's a time and a place to be serious with it, but they take themselves so seriously to the point where it's like, I'm this person all the time, but you can't be this person who's like that all the time, and I've had plenty of physicians that I've met in the past that, they're able to turn it off. And it's like when you're talking peer to peer, or you're talking to your coworkers, like it doesn't have to be like medicine's very hierarchical, and it's very like, you're this position, you're that position. I think if you just take yourself less seriously, it takes a lot of the pressure off, and you're just kind of like, no, like let's collaborate as a team, like we'll figure this out. Just at work, that helps a lot, like not being like, I know all the answers, like, like have the people who've been there like help you out. And accepting that's hard, because you're in this position of like, you are the one who are putting in the orders and signing off on papers. But it's like, if you ask people like, hey, like, what do you think about this? And they're like, no, like they don't actually do that all the time. Like the nurses always help me out. I'm like, what dose do you guys usually give? And they're like, well, we've never seen the dose you prescribed. So I'm like, all right, cool. Like maybe I should change that. Like, I think that helps take the pressure off myself. And just accepting like, you can always use help, and like doing that. So I think that's one of the ways I've helped decompress myself, because I think a lot of people get too caught up in just taking on too much by themselves. And I think helping delegate some of the stuff you have in your life really helps take the pressure and stress off you.
Absolutely, man. Delegation is definitely a huge thing, just keeping,
Yeah.
and
And it's
definitely
tough
breaking
to
down the
do.
hierarchy too. It is. It really is, man. It really is.
Yeah.
I had one other guest I had on a couple episodes ago. He's he's an entrepreneur, and he was talking about how he just recently like got a team during quarantine of virtual assistants. He was like, there's so many things that he was able to kind of get done, not have to use his brain power on, but now it's like, how do I get the team to do this? How do I get the team to do that? That team atmosphere, and kind of flowing off each other and having people do stuff to save you time, but then also like having the time to like make sure the people are still treating like people is tough, man.
Yeah.
Do you feel like where you are so far, being a resident in your field, like how does that feel with the team environment there?
So it's a huge team environment just within our like residency itself. Like, like a lot of our rotations will have like two interns, like first year residents, what they're called, like me, and then we'll have like a second year and a third year, and then our attending, who's like the head of the head. And just that collaborative, like, this guy's not getting better. Like, what do you guys think? And like, we'll know stuff, and we'll be reading new things that, we'll tell our attending like, oh, I haven't looked into that. Or like, they'll tell us stuff like, oh, this is a classic case of this. They just don't teach it in the textbooks like this. So that stuff's good. And then like the delegation thing as a resident is like, you're a physician, but you're not at that level. You're still like, you're still in training. So,
Mm-hmm.
It's tough to tell people like, hey, like, do you mind like setting that whole thing up for me? And then I'll come there and like do whatever suturing you need me to do. So like, sometimes I feel bad asking. I'll just like, rather than be like, hey, go do that. I'm like, no, like I'll do that. But then like people will tell me like, hey, you're like the resident, like we'll set it up for you. So you have more important stuff. Like you got to see these people, it's like this, you shouldn't be allocating your time to this. Like we have people that, are better at you in doing this, because I'm over here like looking at oh, where's this medication? I need this strip and I need these scissors and I need this. But it's like, I'm wasting 10 minutes doing that. The other person does it in 2 minutes. They're like, all right, boom, boom, boom. And it's already set up, you know? So I think accepting that, it's hard though, when you know you want it done a certain way. I think accepting and just helping, I think teaching people what you like, you know, hey, I like this size glove and I like this size this, you know, it really helps out. But it's a hard transition to do. And it's like, you know, especially when you don't want to be a burden on other people, I feel like people have that sense of guilt. Like, you know, I don't want to make someone do something I can do on my own, but, you know, sometimes it's just better off, like, you know, because they're comfortable doing that and they don't feel like you're burdening them.
Yeah. Yeah. Not being a burden, and, you know, definitely that knowing where you are in the hierarchy is definitely super important. Cause I remember doing myself, like I remember the first time me like training people, I was like, oh, like, I don't want to tell them what to do. Like, even though they're paying you to tell you what to do, like, it's literally your job to be that person. But assuming that role is definitely something you're like, you definitely feel a little bit like, I can't imagine it's like being in that position medically. Like, at least I'm still in the gym, but like that medical feeling must be a whole different like hierarchy of just like, okay, this, and this. But I'm sure
it's weird. Yeah. Like they'll people ask me like, hey, like, are you okay with us doing this? And I'm like, yeah. It's like, why are you asking me? Like, we have to ask you. That's like the protocol. I'm like, okay, like, you know, you've been here for 20 years working. Like, I just came here for 3 months, you know? I've only been in this computer for like 2 weeks. Like, you know what the deal is, but it's hard accepting that responsibility and then like being confident in it. But I think it's a good thing, because I feel like some people are overconfident too soon. And, you know, it's a 3-year program. So it's built to make, like, it takes 3 years to get that level where you can be like, all right, that's not this, this is this. It's like, even now when I see simple things, I'm like reading and like looking up all my textbooks. I'm like, okay, yeah, that's it. You know, before I'm just like, oh, it's probably nothing. So it's an interesting learning experience. And like, they kind of just throw you into the fire. Like, this is the epitome of being thrown into the fire. Cause it's like, you're working with people who have been working for 20 years. And it's not like they're like, all right, well, this is the new guy, like, go easy on him. It's just kind of like, you know, just come with us. Like, you know, we expect you to perform at that level. But you have obviously really good support, which is nice. But it's like, you know, there is a certain level of expectation. Like, you know, we want you to hit the ground running and like get up to pace as quick as possible.
Between now and July, like, how do you feel? What's something that you think that you feel like you almost leveled up in? What's something that you think you would kind of struggle in July that you feel better with now?
I guess trust myself in time management in the hospital. Definitely, like, July, every day I was like dreading going in. I'm like, oh, this is like 12 hours. I have to like be here, or 14 hours. And like, everyone's going to ask me stuff. I don't know what to do. But now it's like, when someone asks me, like, you know, medical jargon, like, they're like, you know, are you okay with X, Y, and Z? I'm like, okay, I know what X, Y, and Z. Before in July, I was like, what is X, Y, and Z? Like, do we do that here? Like,
there's such a bigger role for people to just, so much more awareness came out too, just between like, you know, how important your health is, how important your family is, you know, like how much the important things are actually like closer to you than what you think, you know, just slowing down and kind of putting yourself in perspective and taking care of your health is just like the overall message of what like this year has been about, you know, taking care of your health and focusing on what's important. I don't know what even like with 2021, I'm like, the fuck's gonna happen next, man? Like, what's the next thing?
Don't ask, because it'll show you. It'll show you.
It definitely will.
Like, honestly, I like, not to like, I'm dead serious about this. Like, since Kobe, it's like hasn't been good. And I feel like, I don't know, just that was like a crazy thing in 2020. I remember that felt like years ago. But that's like a huge like fitness and sports, just like overall mental and physical health, like the icon of that, and just like doing good for the community. Like, him going was like a big thing, and that just felt like forever ago. So it's just weird how time works, and just like how our minds like just process all these different events, and it's like, all right, it happened and we're just over it. And I feel like that's like a big issue that we like, you know, unless it really impacts us, we kind of just let a lot of things go, and it's a problem, you know?
You definitely do, man. It does feel like that Kobe thing definitely feels like, rest in peace, Kobe Bryant, but it definitely feels like that was like 10 years ago. And that was like a couple months. And it just only seems like the more the year goes by, the more it's like, oh shoot, like Tiger King was 3 months ago, but I feel like that was like 10 years ago. And like,
I saw Tiger King 3 times through.
Really?
I loved it. I thought it was the greatest thing ever.
It's funny. It's funny.
If you just take it for face value, like, just, and don't think too much about it, it's hilarious.
I wonder how they even find those shows. Like, how do they even, like, the process of what Netflix has to do to find Tiger King or anyone that fits like that next model is insane. Like, I don't even know. Like, you have to have an
I'm
eye
sure they
for it.
have people just like on BuzzFeed, like, oh, this guy, like, imagine like these people, like, I always think like Tiger King didn't set out doing all this stuff to be like, one day I'm going to bank on this like Netflix series. These people just live their lives, and it really shows you like just live your life how it is, and it's just gonna like if it's meant to happen for you, it's gonna happen for you, right? It's not like you're not doing this podcast to be like, oh, and like I can't wait in 10 years to be like, oh yeah, I started out on this podcast. It's like just do what makes you happy and do like what you're gonna do, and like you never know where it's gonna lead you. That's like the fun of it, I guess.
That is the fun of it because
Like he was making all those YouTube videos for nothing, just like rag on Carol Baskin. Like he didn't think anyone was gonna see it, or he thought like I guess apparently had a good following. He was making the videos. It's just funny.
that's the craziest part. Like he was doing all this and like had no idea he was about to be like the biggest thing of like
Yeah.
2020 in a sense.
Right.
That
Besides
just goes,
COVID, obviously.
yeah. Besides COVID, this goes to show that like you be yourself and just that's all it really is. Like your individuality is enough of a story in itself.
Yeah.
I think that some other shit that like we could have that like with this coming up and like the election and stuff coming up, like there's just so many things this year. Just like more like the pressure's just building and building and
Yeah.
building and building. But I think
It's interesting.
I feel that 2021, like even if things are similar even if like as far as how quarantine is, I think that when like the ball drops in this new year, I feel like people are still gonna have like a new sense of just like, all right, that year's done. Even if things haven't changed that much, that like that mental of just like it's not 2020 anymore will definitely help people feel a little better. I feel like there's still certain spots where there's still like a lot more fear in people, a lot more anxious. I think
Yeah.
that at least the change of the year will definitely like cool people out a little bit. What do you think?
Yeah. No, I agree. And I think like, um, with the holidays coming up, because they're coming up fast. Like, this part of the year always just like speeds up. It's gonna be at Christmas before we know it.
Mm-hmm.
It'll give people more a sense of like, if people aren't able to travel, and just kind of like give them, like we said, more time to reflect and be like, what's most important. Like, I was thinking like, like we're so materialistic, and like people are like, I want to get this job with this much money, but it's just like, like all the money in the world, like, is that really helping you in COVID? It's like, you have all this money, you can't spend it, and I feel like COVID is a great example where it's like, but if you're around the people you really love and you're doing something you enjoy and like are able to do X, Y, and Z, like that's what really matters. And like, I feel like everyone's focus should be shifting towards that and like sustainability. And like, like even if like for me, I'm thinking like I want this crazy job with like all these opportunities, but then it's like one of the things I love so much is fitness, but it's like in my day, it's like, if I make X amount of money less, but I'm able to go to the gym every day for like 2 hours, and like, that's like happy. Like, I know you follow Gary Vee and he's all about that. It's like being content with just like what you love and like not worrying about what anyone else thinks. I feel like COVID really brought that to light, and people being able to, pursue their passions and hobbies, like given that they're like, they're saving an extra 2 hours with their commute, working from home and all. So it's interesting to think about like how much do you really need, and like how much more happiness that you can't even buy is worth you just being able to do what you actually enjoy with who you enjoy.
Yes, this year is definitely like Gary Vee's message definitely has gone through like twice as much since this time because
Yeah.
people's jobs have changed, situations have changed, freedoms have changed. So I think definitely doing what you're happy and like doing what you're content with, and you can be your own Tiger King, your own world. Like it's definitely
Yeah.
definitely the main message this year.
Yeah, definitely. Because now it's just like you're not going out to like impress people and do all this stuff that people think they have to do. It's just kind of like you're by yourself, and like doing what you enjoy, like, and whatever that is. And just I feel like people are, I guess, scared to do it, I guess, but like once you open up and realize like, this is what I like, and like as long as I get to do this every day, I'll be happy, regardless of whatever things, people focus on what like, oh well, that person's doing this and that's cool. But I'm like, well, do you even like doing that? Like, do you like shopping that much, or do you like being on boats that much? But it's like, if you like doing this and you're able to afford doing it, it's like focus on that. If people focus too much on like, well, that person gets to do this. I'm like, well, that's great for them. Like, look at how much you get to do that. Someone's looking at you being like, wow, I can't believe they get to do that. Like just
For
with
sure.
people in the hospital, I see all the time. That's why I have such a big push for like preventative health and like preventing people from getting to the stages. Cause I feel like people I see in the hospital, it's like, they would love to just be able to like people would love to just walk down the street without having to require oxygen, or just like without having to go to like all these doctor's appointments. And like we put them on like 20 pills, and it's just like, imagine just taking 20 pills, even if you felt fine. Like, you know, we take supplements by choice, but you know, if you had to do that every day, and like if you miss one, your like whole being is just like messed up for that day. So it's like we take it so much for granted that like we're just healthy, and that should be like not enough, but like, you know, you should really focus on that and like be grateful every day that you're not like, you know, we don't have these limitations in fitness, you know, like we can move so much weight and we can move our bodies in this crazy way, but it's like at a certain point you're not gonna be able to do that. Or like the I guess the hope is longevity and being able to sustain that.
Yeah, taking 20 pills a day or not being able to walk, that's a big, like,
and it's a reality for a lot of people that like,
is.
you know, you and I don't see, like, you know, like if you're not in the medical field, you don't really see it, and you kind of think it's the exception. But it's like when you're in there and you see these people, it's like it's more than you think. And it's just because your social network and like the people you hang out with just don't have these kind of chronic illnesses. But it's like for the people who's it's their reality, it's just like just imagining like a day in their life is just like terrible. It's like you wake up, you take this pill to feel this certain way, and like if you don't, you have to take this one. And like just keeping track of it. Like we're already having trouble prescribing all this stuff to you, and like this person who doesn't even know what they're supposed to do, like, you know, it's we talk to the patients like, yeah, well, I take like this blue one, I take this red one twice a day, and like they told me not to take this, and like they don't even understand themselves. So it's like this big push like for preventative medicine, like, and it starts at like our age right now. Like, you know, like everyone feels like they're can drink as much as they want, they can do whatever they want and not take care of themselves. Like, oh, I'll just eat healthier when I'm older. It's like right now, you know, because you see people earlier and earlier coming in 30s, 40s for like chest pain and all this stuff that could have been prevented. It's like there really needs to be a push for like healthier eating, healthier lifestyles in general, like mental and physical.
Yeah, man. Yeah, I mean, these are the times, man. Like this is when it counts the most. You can always start the process of making better you today, man. That's the truth. So Ravin, for people that want to find you, they want to follow you, how do they get in contact?
Yeah. So I'm on Instagram. My first name, last name, @Ravin Patel _ That's my fitness page. I also have more of a medically inclined Instagram @Vinny Patel. I don't know if you follow that, but it's like has some more followers. And if you're more into like medical content, I had that. And then just hit me up on DM if you want to talk more preventive health or fitness, training, anything like that.
Awesome. Well, guys, definitely give them a follow. Ravin, thank you so much for being on. Guys, thanks for listening, and take care.
Yeah. Thank you so much for having me on.